Did you know that diabetes is the leading cause of lower limb amputations? Up to 85% of these amputations are entirely preventable with early detection and care. That's why everyday diabetic foot screening is an absolute must for general practitioners. Our main goal here is simple: look early, prevent ulcers, and avoid amputations. Every single person with diabetes needs to be screened at least once a year, or even more if they are high risk. So, who is most at risk? Look out for patients with peripheral neuropathy, peripheral arterial disease, or a history of previous foot ulcers. Deformities like hammer toes or charcot foot, poor glycemic control with an HbA1c over 7.5%, smoking, and having diabetes for over 10 years all skyrocket the risk. To catch problems early, use the 5-step foot check. First, look. Check the skin for dryness, cracks, calluses, or ulcers. Second, feel, test for peripheral neuropathy using a 10-gram monofilament at 10 distinct sites on the plantar surface. Third, check vibration perception with a 128 Hz tuning fork on the great toe. Fourth, palpate the foot pulses, checking both the dorsalis pedis and posterior tibial. Finally, assess their footwear, gait, and self-care education needs. Always document your findings, risk classification and testing. When using the 10-gram monofilament test, interpretation is straightforward. If they feel it in 8 or more sites, sensation is normal. If they feel it in 7 or fewer sites, there is a loss of protective sensation, placing them at high risk. Classify your patients immediately. Low-risk patients need annual screening. Moderate risk patients need a review every 3 to 6 months. And high-risk patients require intense review every 1 to 3 months, alongside specialist referrals. We must empower our patients with the 6 golden rules of foot care. Teach them to inspect their feet daily using a mirror. They should wash daily with lukewarm water and dry thoroughly, especially between the toes. Moisturize dry skin, but never apply lotion between the toes. Cut nails straight across, wear well-fitted footwear, never walk barefoot, and report any cut, blister, or redness immediately. Good care today prevents disability tomorrow. When should you refer immediately? Look for active ulcers, suspected osteomyelitis, critical limb ischemia, or severe deformities like charcot foot. Optimize their overall care by controlling blood pressure, managing lipids, and encouraging smoking cessation. Ensure proper footwear with a wide toe box and soft insoles, or use offloading options like custom insoles and total contact casts to relieve pressure. A minute to examine means a lifetime of mobility. Screen early, classify accurately, and save limbs. Follow us on Instagram, Facebook, and YouTube for more daily medical insights. Thank you.